Okay, thank you very much for people here in the room and for the people attending online. I see people are still joining for this session, so apparently the trick with the links has worked, so people know where to find us. And welcome to this breakout session on the impact of animals in society. And I think we got three interesting presentations, starting with Karel on Health for Animals, then Nancy de Brienne, Federation of Veterinarians in Europe, and then my esteemed colleague Sebastian Giraud on different topics that we think are relevant for this session. I just came from the other room, so I've forgotten to take the bios of the speakers, so I do apologize for that, Karel. But I know who you are. Look at this. Here we are. So, Karel is the Executive Director of Health for Animals, which is a global animal health association representing the top 10 animal health companies developing veterinary parasiticides, vaccines, pharmaceuticals, diagnostics, and digital products. Karel joined Health for Animals from Europe Bio, the EU Biotechnology Association, and prior he worked at consultancies and think tanks in Washington, D.C. and Brussels, advising on policies related to food, agriculture, chemicals, climate, and biotech. So my conclusion is you're a seasoned lobbyist, Karel. Is a Dutch national, holds degrees from the University of Leiden and Johns Hopkins University. And I would like to give you the floor on the first presentation today, Societal Impact of Animals.
Thank you very much for that introduction. I am actually not a lobbyist because we don't lobby at Health for Animals. The Health for Animals is, as Ivo said, the global industry federation for the top 10 companies and also for about 28 federations around the world. We represent in total about 200 to 250 companies, we estimate, through our national federations and directly. And I have coordinated with the next speaker, Nancy, to make sure that our content is not repetitive. And I know that our third speaker is speaking about something a little bit different, so we didn't coordinate. But I'm going to try and highlight some of the important aspects, I think, of animals and the relationships to society. So animals have multiple impacts on society, and on the slide you'll see the four different headers on that. So wild animals obviously have environmental functions like fish, which are very efficient long-term carbon stores, bats, which are, somebody termed them the natural pesticides, bees, pollination, worms, soil aeration, etc. Farmed animals provide about 30% of our global protein consumption, 17% of calories. Different per country, but that's on a global basis. Companionships, which was mentioned a lot today. Pets obviously provide significant companionship. Working animals help us with in all kinds of ways. People in Europe may not think of the plow anymore, but in many parts of the world, working animals are still used to work the land for power, for guarding things, for guiding, for rescue, for detection of mines, etc., etc. So these are all the positive kind of general roles of animals in society, but they also have some negative impacts. If somebody could help me push I'm not getting any, no. Oh, you can push the next slide. They also have some negative impacts, and I'll just mention four of them again. There you go. Obviously, disease source and spread. 60–70% of diseases are zoonotic, and that's a problem for the human species. Destruction, wolves who destroy or consume livestock. River crayfish. My wife is Swedish, so we consume river crayfish as a delicacy in Sweden, but in this country where EMA is, it's considered a destructive source in the rivers. Elephants, wild pigs, etc., etc. And obviously emissions, they emit emissions, particularly ruminants, obviously methane, and that contributes to warming. Um, Animals also consume resources, and some people would argue that some of these resources globally should be used otherwise. And I'll come back to that point. So if you could go to the next slide, please. I just wanted to set out what I think are the 5 most, I think, important societal trends which are impacting animals and which will have an impact on animals. So again, a lot of people know this stuff, but it's important to emphasize some of these points. We will have 1.7 billion more people in 2050. We already have significant hunger and malnutrition. 600 to 800 million people is what the FAO says. And we have significant consumption changes. So a large part of the world is moving toward animal protein. Land use is changing very rapidly with urbanization. That leads to more contact with animals. And there's multiple reasons for all of these complex problems, and there are also multiple solutions. Environment, extreme weather. We've had a very interesting summer in Europe. Farmers being exposed to more extreme weather means they have challenges and they need to reduce their emissions. And food production needs to evolve in that sense, food production systems. Socially, pets have become our family. Come back to that. Pet populations are growing very rapidly worldwide, and pets are getting older. Older pets have the same problems as humans, and one of the impacts of that is that health spending on pets is increasing. All of that, if you could click one more time, means that we will have more animal protein, more disease, more sustainability required, more pets, and more spending on pets. Those are the impacts. So let's look at those. If you could go to the next slide. Here's a slide. Here's an indication of increase in livestock commodity production. This is from the FAO. I think these types of data fluctuate a little bit over time, but it basically shows that there will be increases in all of the major animal protein commodities, and quite dramatic ones. Fish from agriculture, being and poultry, actually, I think nowadays is one of the larger ones with the latest data. But this shows that, contrary to what a lot of people believe, there will be more animal production in the world and there will be more animal consumption. And these figures are probably on the lower end, some people say. And if you go to the next slide, if you look at pets, companion animals, same thing, pet populations. Now, it's very difficult to estimate how many dogs and cats there are. Some people say there are in between 700 million to 1 billion dogs in the world and 400 million to 700 million cats. But what we certainly know is that pets and the number of pets around the world are increasing quite dramatically. And it wasn't just in the COVID time, it had started way before that. And here, these blue charts kind of give a sense of how many pets there are in some of the major markets. Again, these are not counted very carefully. That's why there's such a wide range in the pets, in the dogs and cat estimates. But there will be more companion animals, and there are no indications that this is going to go away, this trend. So let's move to the next slide. And I'm going to talk a little bit about different aspects of food security, nutrition, and livelihood. I mentioned how many people are suffering from hunger, but it's more shocking to know that about 25 or more % of that means that children who are not getting the right nutrients are actually stunted in their growth. That means they're not growing their full physical and mental capacity. 25% of children, that's a lot of people. And meat, milk, eggs, and fish have the micronutrients that are needed in these regions, particularly the developing world. And animal protein in many of these places is the only way, or the most significant way in which they can get these micronutrients. It was mentioned earlier today, 12 zoonotic diseases sicken about 2.5 billion people each year and are probably responsible for about 2.7 million deaths annually. That's FAO data. And then if you look at the livelihood side of things, livestock production employs over 1 billion people and many of the poorest in the world. And these people are often very dependent on livestock for rural livelihoods, for their livelihoods in rural settings. In rich countries, 40% of agricultural output is actually livestock. In more developing world, 20% is livestock related. And therefore, the protection of these animals against disease, whether that's veterinary access, which Nancy's going to talk about a little bit, or vaccination or other approaches, protects not just life, it protects livelihoods. And so here's the yes, but section. I know a lot of people will say, yes, but there's enough food. We just need to distribute that food better. And I would say, yes, that is absolutely correct. There is probably enough food in the world, but it's not distributed properly. The problem is it is not happening at a rate fast enough, this distribution. And therefore, not only, but the prime answer to that should be to better distribute, to better enable people to produce their own food. And part of that in our section, in our sector, is to ensure that their animals stay alive and don't get sick and produce. And then there's another yes, but. Why don't we just avoid animal protein and consume plant-based alternative meats or milks? And you know, certainly there's a trend in that in Western richer countries. It's a very small niche market, and it has been struggling recently because consumers find some of those products too expensive. But it will always be there, alternative meat and milk. There are questions about health impact. There are questions about the environmental imprint of some of these products. And where we see that in the rich developing West countries, we see the consumption rates in meat as follows. White meat and poultry is flatter up, and red meat is flattish. But we don't actually see significant reductions in animal protein consumption. It's just movement between categories. Another yes, but, or the last yes, but I have actually, why don't we grow food instead of feed? So feed goes into animals, food goes into people. And there is an argument that says we should not spend so much of our global production on animal feed, which goes into animals. Well, actually, it's probably the most efficient way to feed people on this globe, because about 86% of what animals eat are grasses, leaves, oil seeds, etc., which cannot be consumed and digested by humans. And they make that into nutritious foods, which provide these micronutrients and vitamins, etc. And so it's not as easy to say we shouldn't just grow feed and grow food instead, and because a lot of those areas and fields cannot grow food. And I think maybe one last comment on this part is the need to be sensitive culturally, cultural sensitivity. We need to be careful not to take a Western kind of developed world view and apply that to the whole world. That gets you into trouble, and it makes that the solutions are not real solutions. If you move on to the next slide, please. Let's look at livestock disease and prevention. So in normal times, livestock is lost to disease. And what I mean with that is that they get dead or they get sick and therefore are not producing optimally. Now, it's very difficult to say what is a normal loss rate. Some people say 1%, 2% in developed, modern, super, well-equipped production facilities. But you see 60% losses in some developing countries or more. And the causes are the obvious things: disease, drought, infestation, conflict. And I think that is probably the right order as well. Couple of examples: high pathogenic avian influenza. The latest number I've seen is probably more, Dr. Clausen, but 500 million dead birds across the globe since 2009, farmed and wild. This has cost billions. It's also dramatic. Dramatic for biodiversity, and it's increased egg and poultry prices. African swine fever, ASF, has now made its way into Sweden since last week. 700 million pigs lost in the 2019 outbreak, and most of those are in Asia. And then there's the other ones, mastitis, Rift Valley, PPR, etc. 3 out of 4 of these are said to originate in wildlife. And we often forget the parasitic diseases, but in livestock and pets. But vector-borne diseases are about 17% of all infectious diseases, and they cause about 700,000 deaths annually. Let that one sink in. Vector-borne diseases represent 17% of all infectious diseases, and they cause 700,000 deaths annually. And that's not just in the developing world, but also more and more so in the richer world. So disease prevention, if you could do the next click, please. On farm, the obvious routes, biosecurity, firmly on place number one, biosecurity, vaccines, better feed, veterinary access, analytics, preventative antibiotic and parasite control use. On the policy side, we have surveillance, notification, border controls, zones to limit diseases, and better emergency preparedness. But what's required, particularly on the vaccination side, is much better public-private leadership to increase vaccination rates, which are still quite low. We have a report which you can download from our website, which sets out 80 different recommendations on how to increase vaccination and overcome some of these problems. Moving to sustainability, which is obviously, that's the next slide, please, the theme of our century. The effect of climate change. We're seeing all this disease spread due to the changing climates. People are more exposed to these vector-borne diseases. Blue tongue spreading in Europe. I was told today that there are blue tongue cases, a case in the Netherlands for the first time in a long time. And of course, the numbers are very different. 5.8% upward of greenhouse gas emissions come from livestock and manure, and that needs significantly more action. FAO says that they think that existing practices could actually reduce greenhouse gas emissions from livestock production by about 30% if those existing practices were applied properly. So if you, one more click, please. We have all these tools. They are there. More will come, but it's an obvious formula. If you take care of animals better, you lose less animals, you produce more output with lower resources. That is the definition of producing more sustainably. And vaccination, you see that, for example, there's a 40% global vaccination rate for cattle is associated with a 5.2% reduction in land use to be able to feed that cattle. If you do one more click, we have just produced a report called Animal Health and Sustainability, where a number of scientists have calculated what increased vaccination rates and other uses could do for sustainability. For example, a fall in livestock disease of 10 percentage points is associated with 800 million ton decrease in greenhouse gas emissions, monthly methane emissions. I would very much encourage you, it's a very comprehensive, large report, I won't go through it, to have a look at that if you're interested in that subject, about how better production, better animal health leads to better production, leads to lower emissions. Maybe quickly turn to the next slide, which is about the human-animal bond, which is the pet and companion side. So I think today a number of people have mentioned the pets and their importance to the human, i.e. societal impact of pets. And there's a number of them listed there. I think there's more and more evidence for that. If you do one more click, there's a great report which was produced a couple, I don't know exactly when, but it's about the human-animal bond, and it gives a large number of studies and indicators on what the value is and what the impact is for humans and animals. And I just want to emphasize also, because we're at EMA, and I don't think I have to tell the colleagues at EMA, the number of products coming onto the market is increasingly pet products for companion animals. Anecdotally, when I started in this sector about just under a decade ago, 60% of what was coming out of the animal health companies I represent was for livestock, and 40% was for pets. It's the other way around now, and that's in 8 or 9 years. So that's a good indication of how I think the growth of companion animals is driving things. Two more slides. So a couple of final observations on pets, and then a couple of final observations on regulation. We need to recognize that things are changing. Pets have moved from outside the house. In my lifetime, and I'm very, very young, in my lifetime, pets have moved from the house to inside our beds. That means that the way that we interact with pets has to change. And the obvious one there is parasite control. They're living longer. one estimate I saw was up to 230% longer in some nations. That's because of vaccination. That's because of better veterinary care. That's because of improved awareness of animal needs, pet needs. But aging pets are also getting all of the same diseases that, or many of the same diseases that humans are getting. Cancer, liver disease, arthritis. One more click, please. Fleas, ticks, worms remain common and continual issues for pets. You cannot say 1 year I'll treat them or preventatively and 1 year I will not. And some of them actually do make their presence in your house into a household health issue, not just a pet health issue. So all of a sudden, because we have our pets in our beds or our houses, problems which used to be limited to pets outside or in the at best in the kitchen have now become household health issues. And the veterinarian, I shouldn't preempt. The speaker after me is a veterinarian, so maybe I shouldn't make this next comment. But veterinarians are recommending that whole scala of solutions to ensure that those pets remain healthy, and there are a lot more products to deal with all of those issues. So turning to the last slide, which is about regulation. I'm sorry. Yes, maybe just go back one click. If you're interested in these issues, we have a great report online called the Global State of Pet Care, which has a lot of data on all of these different things about collected from around the world. So turning to indeed regulation and innovation. We very much like the idea that we have the same regulatory requirements to get our products onto markets around the world. Good rules are good. Let me emphasize that again. Good rules are good because they protect animals, they protect consumers, and they keep substandard products off the market. So we are supportive of good regulation and good implementation of good rules. But meeting these increasing, and they are increasingly higher regulatory requirements does make it more expensive to get products on markets. And therefore, certain products or certain companies may choose not to put certain products onto certain markets. And that's not particularly a good thing for accessibility of some of these products in some markets. And there is a need to boost the availability, especially of some of the essential indications of some of these products. They need to be available. Good cooperation with regulatory agencies, not just in Europe, but around the world, is important about innovations. And I have a nice little chart here, if you do one more click, of some of the innovations, just listing some of them by all means, just examples of some of the stuff that's coming onto the market, that has just come onto the market, that's going to come onto the market. I'm not going to go through these for lack of time, but maybe just highlight something like digital innovations, where you can now use predictive technology to predict exactly when herds, when illness will strike a herd, and so you can preventatively treat them, or when a certain species of dog might get have a problem, at what age, and how to preemptively deal with that. Nutritional products, great example, which methane reducing nutritional products, or nutritional products which allow for better, a more optimal, or I would say more responsible use of antibiotics. Lots of stuff. And all of these innovations, the folks at EMA have to deal with, are already dealing with, and in the future will have to deal with. So I think I'll leave it at that. And I think I stuck to my 20 minutes, Mr. Chair. If not, my apologies, but thank you very much.
Carol, you did a great job in bringing, a wide variety of topics, which are all relevant, I think, for this session. And really would like to thank you for that, because it shows the diversity and the impact, indeed, of animals in society. So thank you very much. And with that, I would like to hand over to Nancy de Brienne. And Nancy is veterinarian by training, already mentioned by Carol. She studied veterinary medicine in Ghent, and she worked as a veterinary practitioner in Belgium and the UK. And she joined the Federation of Veterinarians in Europe, where she has worked since 2000. And currently, she is another executive director here at the table, very good, at FVE, driving initiatives in key areas, including veterinary medicines, antimicrobial resistance, animal welfare, and the status of the veterinary profession. She is a diplomat for the European College of Animal Welfare and Behavioral Medicine, and a member of the EU Platform of Animal Welfare. And in recent years, She was also a well-valued member of the management board of this agency, representing civil society on that. So, Nancy, please, you have the floor.
Thank you very much, and thank you very much for the invitation. It's really a pleasure to be here. As Karel said, we try to alienate a little bit to make sure we don't overlap too much. But of course, some of the issues we will tell about are quite similar. I will focus a little bit more on Europe. I will start with the position of animals in our society, and it has already been said many times, this position really has changed. And this, of course, brings new challenges for the authorization, bringing on the market of veterinary medicinal products, but there's also solutions to that. So just very briefly where I'm from, I'm the executive director of the Federation of Veterinarians of Europe, and we're basically the umbrella organization for all national veterinary associations in total from 38 countries. And we represent veterinarians not only in practice, because veterinarians work also in many other areas like hygiene, in the ministry, in education, in research, and so on. So I will start a little bit with the changing position of animals in our society, and I will really go up very high to more downwards to the animals and to what it also means for veterinarians, the challenges we face, and also some possible solutions. So yeah, the first slide, it has already been said a couple of times, and you've for sure have all seen this slide. Our world population has grown enormously, but just to stand still with it, it has grown 3 times in the last 70 years. This is enormous. So for people that are now 70 years old, they have seen 3 times as many people in the world. Now, this is world data, and Europe data are different. So Europe grown in the same period in 70 years from 650 million to 700 million. So it's not that much as on a world level. This also has impact, of course, to the distribution of mammals on the earth. While in the past we saw that wild animals made most of the biomass of the mammals on the earth, now it's only about 4%. 34% is made up by humans, and 62% of the biomass is livestock, of which and pets is less than 1%. This doesn't include poultry because it's only mammals, and we have a lot of poultry also. So we have a different distribution of mammals in the world, which also means that we have increasing human-wildlife conflicts and habitat encroachment, where humans come into the habitat of wild animals and the other way around. And this, of course, means that we have more potential disease transmission. It was already mentioned in the slide before, 17% vector-borne diseases are huge, and we see them enormously increasing, and climate change really drives this increase. And this is something in Europe we really have to be prepared for, because these are some of the emerging pathogens that are coming. We have a lot of other drivers of zoonotic pandemics, and a lot of work luckily is done on this on a global level, also in Europe. So I mentioned already climate change, more travel, globalization, we travel around the world. We have the human-wildlife conflict, we have the demand for animal protein. So all of these, of course, increases the risk for zoonotic diseases, and most of diseases are zoonotic, 60%, and more than 75% of the emerging ones. Now we can think, well, in Europe we're quite safe, but if we look at here this Lancet publication and looking at the global hotspots for emerging infectious diseases, and the one in red and in yellow are the most likely hotspots, and of course Asia there is very red, but also Europe is really red to yellow, so we have to really be careful here also. Another problem we had a whole session about is its antimicrobial resistance, more than 35,000 deaths a year in the EU, of which 70% is healthcare related. And you also heard the enormous efforts that are already done on the veterinary field and in respect to animal health, reducing of antibiotics in the EU, but we need to reduce further, and we also need to look at the global aspect because we don't live on an isolated island. If we look a little bit deeper now to farming of livestock, this also has changed enormously in the last decades. So before we had a lot of small scale family farms. Now we have enormous concentration of farming, and we also have corporatization of farming. So many farms are no longer owned by families, but are really companies. We had the greenhouse gas production, but like already said before, this is and the whole sustainability debate. We have enormous technological innovations and new products, new vaccines, precision farmings, which really help to keep the animals healthy. And we have an increased societal concern around animal welfare. If we look at the companion animals, was already said before also, we have growing numbers, also in Europe very much. And the pandemic has really driven that further up. More and more people have now a dog or a cat, and they are seen as family members. So people really expect the best in-class medical care for them. And their demand for specialized veterinary services, we hear that every day from our members, really increased enormously for companion animals. We know they sleep in our bed. I don't know if it's really new, because this is a painting from the Rijksmuseum here, very close, from 1655, where the dog is also sleeping on the pillow. So we just have done a third survey of the veterinary profession. So every 3-4 years, we do a very large survey among veterinarians to see what is the status of the profession. And this third one, we're just writing up the report at this moment, so it will be available later this autumn. But I just give you already some feedback and results that we can see from them. And the first thing is that now companion animal veterinary medicine is really the predominant field where veterinarians work. So the same what Karel earlier said, that there's no more veterinary medicines brought on the market for companion animals than for livestock. We see the same in the veterinary field. 71% of veterinarians, practitioners now work with companion animals, followed by cattle, 23%, equine 21%, and pigs. And of course, this is European numbers. It differs a little bit between countries, but still we see that companion animal veterinary practice is the predominant practice now at this moment. And this really has gone up a lot in the last years. We also see that we have much more employed veterinarians versus self-employed veterinarians. Before, many veterinarians had their own practice, were self-employed. Now most of the veterinarians work as employed veterinarians. And we see also the corporate sector increasing enormously. So if most of the employed full-time veterinarians work within the corporate sector, 65% compared to 34% in independent veterinary practice. So these also are numbers that have increased enormously. And then the third problem that unfortunately increased enormously is veterinary workforce shortages. We have a couple of years ago, we really saw problems in certain fields of veterinary medicine where they couldn't find veterinarians, such as on rural and remote areas. But in the meantime, in many countries, even companion animal veterinary practices have problems to get new staff. So high workloads, staff shortage are at this moment the top challenges facing the veterinary profession. And we see that in some countries, 40% of the new graduates have left the profession after 5 years. So this is really a huge concern to us, and where we are trying to take actions. Other results that our third survey revealed is the shared commitments of veterinarians across Europe, and one, of course, is One Health. Veterinarians really feel we are a One Health profession. We're health professionals, and we're not always recognized as that. But a lot what veterinarians do is in the field of veterinary public health. Animal health and sustainability is another real commitment. They want to engage politically in future global challenges such as sustainability and resource management. And then, of course, again, animal welfare, where we see a strong societal pressure. So we need, if we look then a little bit more in the field of veterinary medicines, there also we see some roadblocks. And the first one, and I mentioned it already this morning, is the availability disparity between countries. So some countries in Europe have quite a lot of veterinary medicines and vaccines on their market, while some other smaller countries have really very limited number of veterinary medicines and vaccines on their in their country, and this is really a problem. So you have, just as to give an example, Belgium has quite a bit of fish production. Aquaculture has no medicine at all authorized for aquaculture purposes. There's also, we need to ensure that there is an incentive for pharmaceutical investment, and we need to further work on how can innovative and novel products be regulated while still making it possible and having an incentive to put them on the market and balance benefit risk. So if we look a little bit at human medicine, veterinary medicines, we're really very similar. We have the same products, but we have a very different amount of species. In the human sector, you only have one. In the veterinary sector, we have 7 major species and many minor species, and some of them are really different. Fish, reptiles, dogs and cats, to elephants. So we have a lot of different species with all their own needs, and most of the authorizations are done per species. We have, of course, the market size. The human sector has around 97%, and we have social security and insurances who helps for the patients to pay their bills. In the veterinary sector, it's about 3%, and the owner pays. So it's very, the cost of the treatment is very important. And we have the additional requirements for food safety and environmental safety, because we eat many of our animals. So we have to make sure that they're safe. So this is, of course, an extra burden and cost more to bring a medicine on the market. We had a little bit look at the availability of products, and we had a really nice report in 2008. And this was a report made in preparation for the new veterinary legislation, the current veterinary legislation. And it looked at all the different products that were on the market in the different member states. And there you can see, so France had really the most products, more than 6,000 number of products authorized on their market, while, for example, Iceland had only around 300 products. We wanted to look how is this evolving at this moment, and it's difficult to measure. Earlier, Ivo mentioned you have 43,000 products in the Union product database. So we had to look a little bit, and most of the products should be in the Union product database. So this means that the product availability has gone down at least by 1/3, maybe by half, because these are for all the countries, and previously it was only, so if you compare here, France is 3,500, while we had more than 6,000 in 2008. Now, I know this is comparing apples with pears, but we don't have better numbers on this, because it's of course important also for what indications these products are, and so on, and some are similar products, but it would be good to have better data on this, because what we hear is that lack of availability is a huge problem and has increased in the last years. So monitoring availability, we believe, is really necessary. We did a survey on that, and it was on shortages and on availability, and we really saw that there were critical problems with products not available. Vaccines, for example, really important vaccines, also rabies vaccines, anthrax vaccines, not available. Antibiotics, I mentioned it earlier, especially narrow spectrum antibiotics, and these are really critical for reducing IMR. And we should look at what are the essential indications and if we have enough products available for these essential indications. So there are definitely solutions. The first one is the new current veterinary medicines regulation has a lot of potential tools to boost and to increase the availability. There's the extension of the centralized procedure. There's also increased flexibility for the prescription off-label. And we also have the veterinary medicines database, the Union product database, which makes it easier to look at what products, if you don't have a product available in your country, what other products are available in other countries. Problem there is still how to get that product then into your country. And we have further all the efforts being done on the harmonization of the SPCs, the dose optimization, and we have a lot of initiatives also that we heard earlier to stimulate innovation and regulation. So there are a lot of tools. We now have to see that we really use them very good. We still have also some outstanding acts which are really important for veterinarians. One is the one on oral medication, another one is on medicated feed, and both are a little bit connected. And then the list of substances which are essential for the treatment of equines, and the list of substances that may be used for food-producing aquatic species. So, and the rules on the use, the restriction on antimicrobials outside the off-label. All of these are important, and it is important to ensure availability of adequate treatment options in practice. Preventing zoonotic diseases, a lot has been done, and this is really necessary also. Both on the European level, a lot is being done, and on a global level. We have to be prepared. Last time we even didn't have face masks. They cannot catch us a second time like that. So we have to be prepared, and we have to have good surveillance and make sure that we have tools to prevent these diseases. Some showcases, I think, of collaborative solutions where really a lot has been done is first of all on high pathogen avian influenza. It was already mentioned before. This is really a disaster at this moment, but at the same time we see that all globally and Europeanly, everybody is working together to get a vaccine on the market. And many in Europe now, 5 countries are doing pilots to prepare and to see what can be done. So we need to further work on that, but a lot is being done there. Another example was an issue that we raised in respect to FIP. FIP is really a deadly cat disease, and on a European level, there is no treatment available. However, there are treatments available, but owners just purchase them from the internet. So we now contacted all national competent authorities, and many are now finding solutions to this via compounding, via importing from the UK, or via doing the treatments in university clinics. So this is really a nice example of how working together solutions to very difficult problems can be found. And then just to mention, the 25th of September, there will be a whole session on the societal impact of pet animals, which FE joins together with FEDIAF and Animal Health Europe to show basically the benefits that pets are giving to our society, of which Carol already showed the many positive benefits they give. So just to conclude, our world is changing, so we need to adapt also the regulatory framework for that. We need to really try to work on making more products available. We have to be prepared for zoonotic diseases, and we need more preventive tools and alternatives to antimicrobials. But we have the EU regulatory framework, the new regulation, 2 new regulations, which really offers tools. We have the Union Product Database. We have a lot of EU and global initiatives to boost pandemic preparedness. So yeah, to work further collaborative as we have been doing would be great, and to tackle these future challenges. Thank you very much.
Thank you very much, Nancy, for that presentation, which provides a different perspective also from the view of the veterinarians, but also looking at animal owners and the trends there. You mentioned in your presentation the additional requirements that there are for veterinary medicinal products as compared to human medicinal products in food safety and environmental safety. Now we've got the parallel session on environmental safety ongoing. I've just been informed that there's 140 people listening into that meeting. But it's a nice bridge to the next presentation, which is on basically food safety or consumer safety and maximum residue limits. So I would like to give the floor to Dr. Sebastian Giraud. Sebastian is a doctor in veterinary medicine since 1994 and is certified in toxicology and biological and medical sciences. He joined the agency in 2014, and he deals mainly with safety issues of veterinary medicines to human beings, so consumers potentially exposed to residues through foodstuff of animal origin and users in contact with medicine or with the treated animals. He's acting as a secretariat for the CVMP Safety Working Party and other EMA cross-agency expert groups. And before he joined the agency, he worked in the pharmaceutical industry for 17 years as a toxicologist and manager in research and development for new active substances for human use. So relatively new to the veterinary field, I would say. Sebastian, floor is yours.
Exactly. Thank you very much, Ivo, for this introduction, and good afternoon to all. So indeed, the topic of my presentation is consumer safety and maximum residue limits. So this is a topic which is at the interface between animal health and human health. The presentation will focus on 3 ideas: the notion of residues and consumer safety, how the consumer safety is assessed in the maximum residue limits, and how is the consumer safety addressed in the marketing authorization procedures. Notion of residues and consumer safety. Let's take the example of a food-producing animal treated by a veterinary medicine. So the medicine is administered to the animal. The medicinal substance will be absorbed into the body of the animal. It will be distributed into the different tissues. And after that, progressively, the concentrations will decrease because the substance will be eliminated. At the time of production of foodstuff, there may be some remaining small amounts of medicinal substance in the tissues or food commodity. So the production of foodstuff, it could be the slaughter for the production of meat, could be the milking for the production of milk. So at that time, there may be some small amounts of substance in the meat, the milk, or other commodities, and it's what is called the residues. Now, when the human consumer will ingest this foodstuff of animal origin, this consumer will be potentially exposed to this small level of residues. We want that it is safe for the consumer because we do not want the consumer to take a risk, and so this consumer safety needs to be assessed. When is the consumer safety assessed? It's assessed basically at two levels, so two kinds of procedure, the MRL procedure and the marketing authorization application procedures. The MRL, maximum residue limit procedures, its scope is really the consumer safety, and it will respond to the question, what is a safe level of residues in the food commodities for this substance? The scope of the marketing authorization application is obviously much larger. It includes the quality, the safety, the efficacy. Inside the safety, we will have several endpoints: safety for the target animal, so the animal to which the product is administered, safety to the human user, to the human consumer, and to the environment. So you see that the consumer safety is only one of the numerous endpoints of the marketing authorization application. And this will respond to the question, when is the safe level of residues reached for this product? And this is the withdrawal period. The MRL procedures. So the definition of the maximum residue limit is indicated here. It comes from the regulation. So the MRL is the maximum concentration of a residue of pharmacologically active substance which may be permitted in food of animal origin. So it's a concentration. It's expressed in microgram of residues per kilogram of food commodity. And this is the maximum concentration that is allowed. Principles and objectives of MRLs. So as said, the main objective is to ensure consumer safety. Consequently, the MRLs must be set at a level which is safe for the consumer. In practice, this setting of MRLs is based on safety data and on residue data. Later, the MRLs are used to establish the withdrawal periods within the marketing authorization procedures. And also later, the MRLs are used for residue surveillance by the member states. So when controls are made by sampling, the measured concentration of residues at the controls should be lower than the MRLs. The MRLs facilitate trade within the European Union. It avoids barriers to free movement of foodstuff between member states. Indeed, the MRLs apply to all member states, so all member states have the same criteria of acceptation of the food. Some regulatory and procedural aspects of MRLs. So an application for establishment of MRL is a standalone centralized procedure. It's not part of an application for a marketing authorization. The fact that it is centralized means that the scientific evaluation for all MRL applications are performed by the CVMP. The establishment of MRL is a precondition for the marketing authorization in the case of VMP for food producing animals. It means that if the substance has not been evaluated and allowed in the context of MRL, there cannot be a marketing authorization. So you see that we have these two-step evaluation. First, the evaluation of the substance in the MRL procedure, and it will lead to allow the substance. And second, the marketing authorization procedure leading back to the authorization of the product. The MRL process has some similarities with the marketing authorization application evaluation. There are also some differences. Here is an overview of the establishment of MRLs in the EU. So the CVMP assesses the MRL dossier. This is a dossier which has been submitted by the applicant. So it includes some safety data, some residue data. It includes how the proposed MRL is calculated. The CVMP, it's interesting to note that it will also take into account the finding of other European or international scientific bodies. For example, if the same substance has already been evaluated, let's say by EFSA in the context of pesticides, the CVMP will take into account this evaluation. And we will also consult the European reference laboratories. The residue part of the dossier includes some residue studies. In the residue studies, they have used some analytical method in order to measure the concentration of residue. So when we assess the residue dossier, we need to assess the appropriateness of the analytical method. And it's in this context that the relevant European reference laboratory is consulted. So the laboratory which is specialized in this kind of method or for this kind of substance. The CVMP will issue a scientific opinion on the establishment of MRLs. So this is MRL recommended by the CVMP. This scientific opinion will be forwarded to the European Commission, and the Commission, in a consultation with the member states, will adopt this MRL, and the MRL will be published in the official journal. So it's published in the form of a regulation, and once the MRL is published, it's applicable in all the member states. Possible outcome of the evaluation. First case, positive opinion. In this case, the substance is included in the list of allowed substance. Is table 1 of this regulation, 37/2010. You see on the slide a screenshot of the first lines of the table. In reality, the table is very long. It's more than 80 pages. So you have all the allowed substance by alphabetical order. And in the middle of the table, you see the middle column with the MRLs. So it can be numerical value, or if numerical MRLs are not required for the protection of public health, this is the entry, no MRL required. Second case, negative opinion. Here, the substance is included in the list of prohibited substances. This is the table 2 of the same regulation. This time, it's a very short table. You see, with only a small number of substances. There are two reasons why a substance may be included in this table, this list of prohibited substance, either because it has been proven that it is harmful, or because it could not be proven that it is safe. No final conclusion could be drawn. There is a lot of information on the MRLs made publicly available by the EMA. You can find them on the MRL webpage of the agency. Here's a screenshot of the top of the page. This page covers the procedural aspects. You will see also the outcome of the MRL assessment for each substance that has been assessed, especially the EPMARS, so the European Public MRL Assessment Report. So these are documents which report the assessment made by the CVMP on this substance. You will find links to different guidelines which are used. So if you are looking for the assessment, how the assessment was done, you may want to look at the EPMARS. Now, if you want to see only the MRL entries, you may prefer to see the implementing regulation or the consolidated version of the regulation 37/2010. Residue surveillance. The European countries implement some control plans for the residues of pharmacologically active substance. So the controls are carried out by the member states. The EMA is not involved in that. The monitoring includes the unauthorized substances, the allowed substance of veterinary medicines, and also some contaminants. So unauthorized substance, it can be the substance prohibited under the MRL regulation, so the ones that are in the list, the list 2 that we have seen, or it can also be some substance that are prohibited under other regulations than MRL regulations. Allowed substance of veterinary medicine, this is to see if we are below or above the MRLs. And so there are also some contaminants which are controlled, for example, some heavy metals, lead, cadmium. And so all that is compiled in a consolidated report by EFSA. I've indicated the link here of the latest report of 2021. And I've extracted what seems to me the two main figures of this report for 2021. So out of more than 350,000 targeted samples, there was 0.24% of non-compliant samples, so all categories included. And so targeted samples, it means the official samples made by the member states in the European frame of residue monitoring. Now we switch to the marketing authorization. How is the consumer safety assessed here? Consumer safety and marketing authorization is based on the MRL classification of each constituent and on the withdrawal period. MRL classification, each active substance and each excipient in VMP for food producing animals need to have an MRL classification. So when we have, each time we have a marketing authorization application for food producing animals, we check that each active substance, each excipient has been evaluated regarding that. The withdrawal period is addressed at the following slide. The definition is indicated here. It comes also from the regulation. So the definition is long, but in short, the withdrawal period, it's the minimum period between the last administration to the animal and the production of foodstuff to ensure that it is safe. So to ensure that the level of residues is safe. And in practice, it means to ensure that the level of residues is lower than the MRL. If, for example, the withdrawal period is 14 days for methanol, it means that we need to wait for at least 14 days between the last administration and the slaughter. And these withdrawal periods are established on the basis of residue depletion studies conducted with the product. And it's established in accordance with the relevant CVMP guidelines. There are two recent or ongoing developments that I would like to mention. The first one is on biological substances not requiring an MRL evaluation. The standard MRL procedure has been used for both chemical and biological active substance of VMPs. However, there was a need for a lighter procedure for some biological substance. And this is because the standard MRL procedure was designed in a way which is very adapted to chemical type active substance. So there was a need for something perhaps more adapted to some biological substance. And it happens also to be lighter. So this new process is now in place. and the grid lines are also described in the regulation indicated here. An application to assess the need for MRL evaluation is received. The CVMP will assess the scientific basis which is provided in the request. And if there is no need for MRL evaluation, then the substance is included in an ad hoc list published by the EMA, the list of biological substances not requiring an MRL evaluation. So this list is published on the website since 2020, because the process is new, relatively new. So for now, the list is short, only a few number of substances are there, but the list is expected to become longer in the next future. Second development I want to mention, the assessment of consumer exposure. The assessment of data exposure of the consumer, it is used in the MRL procedures, and the model used so far for that by the CVMP is a theoretical maximum daily intake. It's based on a standard food basket. It has been noted that some more complex models based on food consumption surveys are used by other organizations, for example, EFSA, and a joint working group under mandate from the Commission has considered the different models and has elaborated some recommendations for harmonization between sectors. These recommendations were explained in a report. This report was published at the beginning of this year, January. So the objective is to harmonize the methodology between the sector of veterinary medicine, the sector of feed additives, and the sector of pesticides. So the grid lines are indicated in this recommendation, and now the work will continue based on this recommendation. My last slide. So the consumer safety, as we have seen, is an important point to consider for the medicines for food-producing animals. This is because these medicines may leave residues in the food from treated animals. The consumer safety mainly relies on MRLs and on withdrawal periods. The MRLs are established at the European level. They are directly applicable in all member states. They ensure that the consumption of the food basket is safe, and the withdrawal period ensures that the residue in the food commodity does not exceed the MRL. So when we are assessing the MRLs and the consumer safety, there are several aspects. There is a procedural aspect, regulatory aspect, scientific aspects. I think that the most important is the reason why we are doing it. And the reason is to protect human health. At the beginning of my presentation, I was saying that the topic is at the interface between animal health and public health. Indeed, we are speaking about veterinary medicines, but the objective here is to protect the health of people. And so when assessing MRLs and consumer safety, the EMA and the CVMP contribute to public health. Thank you for your attention.
Thank you very much, Sebastian, for this presentation. And I realize it's, after the two presentations given by Carol and Nancy, it is different, but I think it is clearly linked because it's good to bring this message that we do look at food safety, and it's closely linked to what Carol mentioned in his presentation about, the trends in livestock production and the use of medicines there. So I think overall it fits well. I would like to open the floor for questions from people in the room and people online. Going first for the room. I don't see questions online yet, but Luca, please go ahead.
I can ask a couple of questions.
I have a couple myself as well, Luca. So.
I have one for Nancy. I was not actually aware this survey on availability of drugs. Was it also including companion animals? And did you find out about any antibiotics that are actually not available for companion animals in some of the European countries? This is a topic of high interest for the Committee of the World, the WASABA, the Veterinary Association for Companion Animals, because we are actually drafting an update of the list of essential medicines for companion animals. So I would be grateful if you could provide some information about that.
Yes, it was actually a survey that we initially did regarding shortages, because you have more and more shortages in the human field, and we wanted to see how it was about shortages in the veterinary field. But what we saw is what in our answers, that some of them were shortages that people answered, but others were just lack of availability. So some products had gone off the market, stop of commercialization. Others were just not available on the market and probably had never been on the available. So for veterinarians that answered it, it was very difficult to distinguish between this is a stop of a commercialization, this is a real shortage because there's a supply chain issue that takes 3 months or so, or this is a lack of availability. So we have it for the different countries, and I can give you the detailed one. What is also interesting is some countries have a shortage website. So, and we looked up at all the different countries. There's about 8 to 10 countries that have nice websites. And so there you can see which products have been taken from the market, which has been really a shortage for a certain period. But yes, there were also lack of availability, and especially narrow spectrum antibiotics. These were the most problematic ones.
Thank you. And then I have a second one for Carol. And this is completely outside my comfort zone, because it's not concerning infectious diseases and microbiology. So I understand there is a great concern about cattle production as a major source of air pollution. No, am I wrong about that?
Methane production. Methane emission.
Yes. Yeah.
Okay. Yeah.
And but then you mentioned at some point that animals are also important to transform proteins that are not edible for humans, and I believe, based on my memories in nutrition, that cattle is probably the best transformer.
Yeah.
Because in chicken and pig production, we actually use proteins that may be used also for the human diet. So is anyone trying to make a cost-benefit analysis taking into consideration, I mentioned 2 factors, but probably there are many more, to assess what are the risks derived from different types of livestock production?
Yeah, definitely. So there's a lot of academic literature about what they call food versus feed, a lot of analyses. That number that I came up with, 86%, is actually from the most recent number from the FAO, and that is for ruminant production. So you're right. Obviously, different animals are fed different things, and that report, by the way, is on the FAO website. I can find a reference for the viewers somewhere. I have it somewhere, but. On the methane production point, or methane emission point, I should say. So there's a lot of discussion, public, discussion about methane emissions from livestock and manure and agriculture in general. If you look at what products are coming onto the market there now, that's a very interesting discussion. So what we see obviously better feed practices, and that's within existing feed products. And there you see products which help better digestion, etc. All of these rumen function things, which reduce 8, 10, 12, 15% of emissions from different ruminants. But there are also specialist products now coming onto the market. Some of them are commercially available. I think one of them is commercially available in Europe, certainly I know, for which reduces methane emission outputs from anywhere 30% upwards to 50% in meat ruminants. And there's a lot of research there. So the interesting question I think there is, you know, methane is a lot more powerful than carbon dioxide. But it, you know, so any gains that we can make in reducing methane emissions from livestock production are real greenhouse gas emission gains in the longer term. So then I expect in the next 10 years an enormous effort to go into that in terms of feeding practices, in terms of different medicinal additives going in. The additive, one of the additives that is approved in Europe was approved by because it's a feed additive, if I'm correct, Ivo, by the EFSA, right? And not by EMA, because that falls under that legislation. So yeah, there's a lot happening there, and there'll be a lot more happening there, I think. And really great gains to be made in methane reduction there. May I just say one more thing about the previous point, Ivo, on shortages and products and markets. So shortages and availability, two different things, as Nancy pointed out. Shortages are shortages. There's not enough. It's there, but there's just not enough. Well, we see that in human medicine as well. In the country we are today, the Netherlands, there's in the human medicine side, extensive discussions about that in the human medicine. So it's not really that different from the human medicine problem of shortages of products on the market. Products not being on the market, so products not made available on the market, is a different issue, of course. And that is a very complex issue of why certain markets, as slides that Nancy showed, why certain markets, why certain products are not available in certain markets. And that's it's a mix of very many different reasons. Some of them have to do with commercial value of that market. So small markets, companies may decide not to put a product on that market. Some of it has to do with packaging. So reduction in the numbers of packages. And that we've seen definitely a lot in our sector, is where a lot of companies have optimized their production capacities, their production facilities, so that they're actually the same products are available, but in different packages. And that's counted as less products on the market. So where there might have been packs from 2 to 5 to 10 to 15 to 20, there might be now only 2 and 20 packages, and that is counted sometimes in those graphics. They are available, but they're not in the packaging or the quantities that they used to be. And then, of course, there's the question of the centralized procedure versus the national procedures. It is the centralized procedure is more attractive in that sense, because you get 27 markets in one go, and that's good for access. But the centralized procedure is, how old is it? It's relatively new compared to, well, that's
28 years since 1995.
Yeah, but most of the products came onto the market in under the national procedures. So companies would have chosen to go in markets X, Y, and Z, and not some of the other ones. So those are just gives you some of the indications of the complexity of the availability of these products on the market.
Just adding on to that also, to the microphone. Adding on to that also, the availability of products. In your slides, you showed a significant decrease of products being available at all. And it's what I've seen in industry, a lot of rationalization is taking place, and indicated a lot of reasons for that already. But it's also, especially the smaller markets, there are a lot of costs related to that. It's costs for sampling for products for the market, and especially in smaller markets, it's done extensively and it costs a lot of money. So keeping a product on the market it's not cost effective. So it's I think that's really what we're seeing at the moment, the increase of costs related to keeping a product on the market, the resources needed to keep a product on the market, and the fees, the increase in fees. It's cause for rationalization, and it's some are good. I think it's also good to really think about what products do you need to keep on the market. But yeah, please also indicate which products are essential, and so we can focus on that.
And I would just add one thing to that. It's not just. I mean, this is an issue, a challenge which goes from small to very large companies. These cost factors. So it's very. Of course, it impacts smaller companies more because they have to be much more rational with their resources. But definitely, it's throughout all companies, this issue.
Okay, maybe on the topic of shortages before I turn to the other topic. A few months ago, we had a stakeholder workshop on shortages for both human and veterinarian, and some of the root causes are identical, some of the root causes are different, as mentioned here, small markets. Plus, on the human side, there is the obligation, if you have a centrally authorized product, to supply it indeed to the patients. That obligation does not exist in the same way in veterinary regulation. And there's it's mandatory to report shortages, which is not here on the veterinary side. To my knowledge, only France has mandatory reporting of shortages, but even there, it's very, you can ask yourself whether that is a system that works. In that stakeholder workshop, it became very clear that there's availability issues, so local shortages, I would call them, due to availability issues, and it could have to do with the attractiveness of supplying indeed individual markets, the costs of keeping those products on the market, not necessarily the supply chain to come to the product, but the supply chain after the product is there in bringing them to the market. However, shortages were reported on, or availability issues were reported on vaccines, one of them, and antimicrobial products. And we said that we would look into that and rationalization of product portfolio, but some of the marketing authorization holder is mentioned as one of the reasons. Where that may seem logical that it could lead to shortages, it also provides opportunity for other marketing authorization holders, because if you have many competitors that go off the market for products that are no longer attractive, it provides an opportunity, of course, for others to step up their production and supply those markets, and hence reducing the costs per actual doses sold in the market. Now, I'm not a market analyst, but I think I do get a proper understanding of how these things may work in practice, and they don't necessarily need to lead to shortages. So I think the report on that shortages stakeholder workshop is out on the website somewhere, so please look for it. Carol, and I was intrigued by the slides you showed on, because you're looking at it from a global perspective, on the increase in production, and indeed on your suggestion to support local livestock production more, and bring livestock production more to markets where it is needed. But and as much as I support it, because I've been working in let's say developing markets in my past career, I also see well, let's say certain risks. In Europe, we've got and North America as well. It's all very regulated when it comes to veterinary medicinal products. The authorization, looking for food safety, residues, environmental risk assessment, AMR, all those areas are well covered, I would say, in the Northern Hemisphere. When you go to other countries, and I've witnessed this in Ethiopia, for example, where parasitic diseases, because they produce the skins, the hides for leather production, and parasitic diseases, damage those skins. Widespread use of anti-parasiticides with huge potential impact on the environment if you don't do it properly. The same for antimicrobials both in Ethiopia as well as in Indonesia, countries where I've worked, and other countries as well. It's over the counter. It's being used widely, despite the fact that there's good intentions and there's regulation in place, but there's no control. So how can we ensure that whilst it is I think, essential that we do support these countries in developing their livestock production, that we do it that we support it in such a way that it can be done in a responsible way. This morning you asked about the potential to work with regulators from other regions. I think this is certainly one of the areas where that would appear to be essential in order to have responsible growth. So over to you, Carol.
Yeah, I mean, great question. Just some rather random observations, which in the short time I have right now, I can't really connect in a logical way, but they all make sense. So observation one, anything, and that regards what comes into Europe. So anything that's produced outside of the EU and is imported needs to meet the MRL levels that were mentioned, and also at global level there are Codex MRLs. So if you don't meet those, your animal produce does not enter Europe. So that's one safety, and a very important safety gauge. Producers who want to export to different markets know that, and they know what they can use and what they can't use, and what the MRLs can be, et cetera, et cetera, et cetera. That's one thing about safety and trade. The other aspect, I think, is responsibility. The Bill and Melinda Gates Foundation has a wonderful, or actually quite a horrific statistic, which is how little money is spent in agricultural development, and even less in the livestock side of things. There is a gaping hole there globally in terms of where the production is taking place increasingly, and where there is help from international institutions or other institutions like the EU development programs or national development programs in terms of helping these entities. It's absurd that the Bill and Melinda Gates Foundation is the biggest financier of these types of projects, much bigger than the World Bank or any of these other institutions. So I think you're very right to point that out. Whether we like it or not, there will be livestock production, and that will increase dramatically in those countries. So I think the responsibility that we in the animal health sector have is to make sure that the people who are making that animal production have access to the right tools. So that means veterinarians, that means our products, that means vaccination. But most importantly, underlying all three of those is the money to do it. And that's where I think you see a big problem, is there's too little financing for the proper development of much of this livestock production. And there are huge advantages to be gained. Saving 60% of your animals, increasing your milk production by 50%, simply with the same amount of animals, by making the animal more productive, et cetera, et cetera. So what we do in our sector is we also take that responsibility very seriously. We have responsible use training programs, and we have, I just looked at the number earlier today. We've trained over 1.2 million vets and animal handlers over the last decade, and we'll continue to do that. That's huge investments on how to use our products properly, and also a whole bunch of other help with veterinary issues. So training is incredibly important. Materials, veterinary access, and responsible use. We have a big project right now running together and with the World Veterinary Association and the Bill and Melinda Gates Foundation and the FAO to train veterinary paraprofessionals in some sub-Saharan African countries. So yeah, these are all kind of just, again, a rather random list there, Ivo, but it gives you.
Just you're not mentioning feed supply, water, to name a few, because medicines alone are not going to resolve the issue. And it's about the responsible use of the medicines as well, I would say. So,
but the responsible use of the medicines is a national and everybody's responsibility, and you require training. And as you said, it's not just antibiotics; it's also parasite control products. But let's be honest, the parasite pressure is much bigger in many of these countries because of the climate, and I think therefore we need to think about how to help control those parasites in a way which we might do differently here. Although I heard today that there's going to be, because of the warm weather in Europe, there's going to be a massive mosquito explosion in Northern Europe in the next 2 weeks. So
I saw that as well. I've got a, maybe it's not a question, but it's more responding to, I mean, methane emission in ruminants, and you mentioned, you know, the 50% decrease, and you said meat ruminants, not dairy cattle. So I hope you include dairy cattle. in
Also
it as well.
dairy. The product currently approved in the market in Europe can be used in both meat and cattle and dairy. Predominantly dairy, actually.
Yeah, there's a bit of an issue with these products, in that they are, in the strict sense, not veterinary medicinal products, because there's no benefit for the animal, and it's not preventing or treating a disease in the animal. It is, however, changing, you know, homeostasis in the animal, probably something in there which is going to happen. So under the current regulation, like with products that may improve animal welfare, there's a problem in getting them authorized, I would say. And I'm not sure where the product that you're referring to is being authorized. I think you mentioned EFSA.
Yeah.
And then it becomes a zootechnical device, or zootechnical.
Yeah, there's one product authorized last year by EFSA and the European Commission, available already in the EU and other markets. And there are other products on their way. As you say, they're not medicinal products, but they offer this societal benefit. But they do have an impact on the animal, obviously. In the case of the product authorized, I think the data shows that they actually help to increase or have a neutral to positive effect on milk production. But I do think that if, you know, as we go to COP at the end of the year, where the United Nations, where they talk about greenhouse gas emissions, this type of technology needs to be prioritized because this is what the world needs to reduce its methane outputs, not just in livestock production, by the way, predominantly in wasted methane emissions from gas and energy. But that's not the subject of today, is it?
But your statement is basically the sector will grow. There will be more animals in the future. So if we don't address issues like methane emission, it will create even bigger problems in the future.
And I also think that with climate change and other challenges that Nancy set out and I set out, we also need to look at other societal challenges, not just methane emission, but also vector-borne disease spread, which is going to, again, I made a joke about mosquitoes break out in the next few weeks. I mean, if you look at the diseases, and Nancy's more specialized in this, that's going to have a major human health effect in countries where it never did, and not just mosquitoes. The other aspect, I think, is foodborne disease, which we see increasing even in wealthier countries, such as in Europe. We see increased foodborne disease, increased sickness from that. And so we need to really look at what we could do at the animal production level to reduce those, like salmonella.
And there's tools available.
Jacqueline.
Yes, thank you. Well, as a parasitologist, I would like to say that in combating parasitic diseases or vector-borne diseases, I think it's not only about the money and the availability and access to medicines. These also present probably the biggest scientific challenges to actually develop something that will work against parasites, because they are intelligent, they are smart, and they're very difficult to, for instance, develop vaccines against parasites. Yeah.
And just to add on that, there's only very limited types of antiparasitics, and parasitic resistance is also a huge problem.
I'm looking around the table. Can I ask you a big question? I don't expect a big answer. And I think it's for both of you. What do you see as the biggest challenge, or let's say the next 5 to 10 years? Well, we'll try to look at it holistically. So it's biggest challenge could be the biggest challenge for the industry, but could also be the biggest challenge for society or for the veterinarians, your profession.
I'll venture to say that I think the biggest challenge for humanity is our impact of the human species, the negative impact. And I'm talking about emissions. I'm talking about, in our sector, obviously, I mentioned it's more more consumption, the impact on nature, and greenhouse gas and climate change is the biggest one. I think this is invariably the biggest issue. So even in our sector, or especially in our sector, we need to look at, talked about all these products, but we need to look at how to optimize, because we do need to eat and we will have pets. We need to look at how to optimize the use of the existing products so that we can get more output from the same or less animals. It cannot be that even in a rich area like the European Union, some cows give, almost a third more milk than other cows. Why is that? Why is that cow not? Because it means we need a third more cows to give that milk in that area. So I think that one is our impact on the impact of humans on the environment and how to produce and do everything more sustainably. That's the overwhelming, I think, challenge that we have.
So it's basically, you say it's how can we reduce or maintain our footprint and still be able to supply animal protein, etc.
You said it better than I did.
I'm used to that, Carol. Sorry. Nancy.
And avoid waste.
Yeah, I agree. Climate change, and how can we live in balance between so many animals, so many people, and still do not, keep our planet healthy. Yeah, that's, I think, the biggest challenge. But we have a lot of tools, and I believe in technological, and people have always found ways. So, and for the veterinary, workforce shortages, that's the biggest challenge at this moment.
And I agree, workforce shortages. Again, I'm with my global hat on in Europe, but everywhere. And I don't think there's a market in the world where we're not seeing this issue. So that means we need more innovative thinking on how to deal with that. So we need to change how we, for example, if public veterinary health is a societal benefit, and I take the example of the United States, where students will come out of university with $300,000 of debt. I mean, maybe you shouldn't charge them for that education. Maybe you should charge them half, or this is not our policy, just to be clear, but
or let society pay for the benefits that they deliver, like you suggested with the farmers,
for example, or using telemedicine. Again, we need the vets. We need the vets to prescribe, certainly, in order to make sure that the antibiotics and other products are applied properly. But there may be ways to access veterinarians indirectly instead of seeing them face to face, and doing that via computers. We saw during COVID that there were some advances there. Now, again, I know that's a controversial issue. Some vets don't like that, some do, but that may be able to access more veterinary care in that way. So I think, again, veterinary shortages. Let's be innovative. Let's be open to new ideas. Let's be cognizant of also the veterinary profession's challenges, which there are many of. But I think there are ways we can move forward with that. If I may ask Dr. Klaassen, what do you think is the largest challenge?
Well, well, let me give you, because when I look at it, I see growth, necessary growth in areas where currently you don't have the production, and maybe the current systems that we're looking at are not suitable for production in those areas, and there's a lot of innovation that needs to happen there, technological innovation, but also technology transfer. I mean, from our countries, because I do feel that the trend in Europe, in North America, I don't know, is not necessarily towards growth. I think that people are being more conscious of what it means to consume animal protein that may balance. And we see the elegant slide that you showed that over the past, 70 years, the growth of the population in Europe hasn't been that significant. Maybe there has been a growth in animal production, but that must have stabilized more or less. So making people more conscious of what it means to consume animal protein. I think there's a huge overconsumption of animal protein in some areas. But I do agree with the fact that it's an important element of treating malnutrition. In studies that I've seen years ago, having let's say backyard poultry for families was the main contributor to having well-fed children and dealing with malnutrition. The single only factor, because of the eggs and the protein that it gave. So that's one area. So how can we support a responsible development of a livestock sector in places where it is really needed, and at the same time maybe bring back? So can we support the growth of the population in supplying sufficient animal protein without necessarily having that sector to grow? And it asks for a paradigm shift in thinking, in how we look at the sector as a whole. So growth is not the holy grail. Sustainability is the holy grail. Sustainability is people, planet, and profit. So profit has to come into there as well. But investing more indeed in local communities, which doesn't mean going back to the Middle Ages where you say you only have 3 or 4 cows. Now, what are the options that we have to supply local markets in a responsible way? Does that help?
I think you put it very well. Thank you.
On that happy note, if there's no one else asking for the floor, I would like to close this session. I would like to thank you all for contribution here, and also the people online. And I think it's time for some social interaction outside the room.
Just before everyone leaves, thank you very much for joining us until this hour. I've just sent an email with the links for tomorrow's breakout sessions. Please be reminded tomorrow starts with 2 different breakout sessions, also different access links. Just check your mailbox. Thank you very much.
Thank you very much. Have a nice day.